Approximately 1.2 billion people are overweight, and at least 300 million are obese. The World Health Organization says obesity is one of the 10 most preventable health risks. Yet, at least 300,000 deaths every year can be linked to obesity. Obesity has become a public health problem in most nations, but studies have shown that there has been a rise of obesity in developed nations such as the United States and the United Kingdom. Obesity is linked to some long-term health problems like premature death and some illnesses, including heart disease, stroke, fatty liver, arthritis, and some cancers. Recent studies have shown that this rise in obesity could be linked to an increase in calorie intake coupled with lack of physical exercise. Obesity results from an imbalance of the amount of calories consumed to the amount of calories spent on metabolism and physical exercise. So what's really the problem? It is well known that eating out may lead to excess calorie intake and increases the risk of obesity because of their large portion sizes and their energy density of food. Fast foods are typically high in calories, fat, sugar, simple carbohydrates, and sodium. Fast foods reduce the quality of diet and provide very unhealthy choices, especially among children and young adults. Fast food is targeted to children. Studies show that calorie content of out-of-home meals that children consume was 55% higher than those of in-home meals. People have many other theories as to why obesity isn't related to fast food, such as their hormones, genetic components, and secreted factors. Insulin is an anabolic hormone, not only in regards to muscle but also to fat. When an individual becomes insulin resistant, more insulin is secreted from the beta muscles of the pancreas. Abdominal obesity is related to insulin resistance and type 2 diabetes. The role that insulin sensitivity, and the control of insulin levels may play in obesity is still a theory that needs to be researched. Leptin is a cytokine-like polypeptide produced by the adipocyte that controls your food intake. Leptin helps to inform the brain of your fat storage. Obese people do not have a deficiency of leptin, but have higher levels of circulating leptin in the body. Obese patients theorize that there may be a defect in the leptin signaling the brain about the fat storage. In reality, this is not the case. Star of My Big Fat Fabulous Life, Whitney Thore, says the reason she is obese is because of polycystic ovarian syndrome, or PCOS. PCOS is a common endocrine syndrome disorder among women. Women with PCOS have enlarged ovaries that control small collections of fluid. Excess hair growth, acne, and obesity can all occur with women with this syndrome. Whitney was a slender dancer her first year at college. By her second year, she was an overweight student. Women with PCOS have higher levels of male hormones and are insulin resistant. This causes the women to gain weight in the abdominal area. Although many people think that fast food is the problem with gaining weight, these theories may also be a factor. To help stay a healthy weight, doctors from Stanford have come up with a few suggestions on what you should do. These include eat 5 to 6 servings of veggies a day, choose whole grain foods like brown rice and whole wheat bread, balance the food you eat with exercise, avoid a lot of fast food since these are high in calories. Lastly, you should take about 15 to 20 minutes a day to do some calorie burning activities. You can always walk around the block or go up and down a few flights of stairs. Getting our obesity and overweight epidemic under control will involve more than just telling everyone to go on a diet. The World Health Organization says it requires an integrated approach that includes promoting healthy eating habits and encouraging exercise. You can also develop public policies that promote access to healthy, low-fat, high-fiber foods. So walk a little more and eat a little less to maintain a healthy BMI. I'm going to close with a quote by Andrew Lansley. We must not constantly talk about tackling obesity and warning people about the negative consequences of obesity. Instead, we must be positive about the fun and benefits to be had from healthy living and trying to get rid of people's excess for being obese and tackling the issue in a positive way.